Now I would like to invite Professor Syed Jamal Raza, Executive Director of Sindh Institute of Child Health and Neonatology and Patron New Life, to share his vision with us.
Bismillahirrahmanirrahim. I'm really overwhelmed by the occasion. Extremely, as a host, first of all, I would like to welcome all of you and thank all of you for being here, because it is such a great pleasure and it is so overwhelming to be having my mentors, my professors, so many of them I can't even name them. Dr. Billu, Dr. Zina, Dr. DS to begin with, and Dr. Professor Iqbal. Thank you very much, and of course the ministers of health, not just one but two ministers of health. So extremely thankful, Dr. Azra and Saad for Dr. Saad for coming here and gracing the occasion. And thank you, Abdullah Saab, for coming for such a short notice. I will not take a very long time. My presentation, I hope, will be a shorter one. But I would like you to take you to a few important things that I would like to highlight. Sindh Institute of Child Health, humne manaya, madam. And I would now like to talk about the impact. Although we have not been there for a very long time, but let me take you through the impact. One clarification, a lot of people when they look at Sindh Institute of Child Health ask, ji, aapka hospital kahan hai? So it's not a hospital, it's a slightly bigger umbrella institute, which was basically started under the vision of Madam Azra and our worthy Chief Minister Murad Ali Shah Sahab, when they were talking about taking the healthcare to the entire province, while I was at SICHN, and of course my plea was that we need to make a separate institute to really, because at that time we were in the federal government and there were a lot of problems in the federal government and Sindh government. So we thought that we should rather make a new institute, and under the umbrella we can do various activities to help out the children. Madam, दो स्लाइडें आपके लिए बड़ी मैं तवज्जो आपकी चाहूँगा. फ़र्क क्या है? I've been working in the health sector for a long time, and we see that, you know, a lot of time we are challenged कि जी governance का problem. Now, having worked at both sides and different sides of the story, the difference that we have been able to make with SICHN, or the work, you know, the free working environment that I'm getting at NICH, I think are because of these three things. And these are extremely important, that we have 100% contractual employment, we have market-based salaries for our staff, and we have the hiring and, you know, firing authority to some extent. And of course, we are involved with the training. So that makes a world of a difference. अगर public sector को वो आज़ादी और वो freedom दी जाए जो private sector को है, तो they can do wonders. And we have examples of that. So my humble request would be consider. और एक, you know, we need to trust on our own people. The government have not, I'm sorry, but the government have not been trusting their own people. They have been like giving out facilities to others. We should trust our own people, give them a little bit of freedom and empowerment, and give them a little longevity. हमारे यहाँ जो आप जानती हैं कि इतने ज़्यादा changes होते हैं, especially, you know, MS होते हैं, हर तीसरे महीने change हो रहे होते हैं. So it's very difficult to expect an outcome from a person who has only been there for 3 months, 6 months. But I can understand there are a lot of other problems, but this was a little suggestion. So this is the first hospital at Korangi that we have started. Some of you have seen, some of you may not have seen it. What we are doing is that we have the largest level 3 neonatal care in Pakistan, as far as I remember, maybe thoda bahut give and take, koi ek aad numbers aage piche ho, but we have 52 level 3 beds, which are highest in number. And similarly, we have pediatric intensive care, largest level 3 in Sindh. Of course, we are doing the general pediatrics, but we are also doing neurology. Nabila is here. Thank you very much, Nabila, for supporting the rehab department that we have made, and we are doing the endocrinology, cardiology, nephrology to begin with. 1.5 साल का सिर्फ हमें अरसा हुआ, and we have treated over 175,000 people, and that is not a small achievement. And these are some very important results. Madam, आप बहुत सारी stats देख रही थी. Let's look at the NICU. Ye wala, sorry. So if you look at the NICU, we have treated in 1.5 years over 3,500 patients with a survival rate of 83%, and even the ventilated patient have a survival rate of 86%. Now that is as good as it can probably get. Even the pretermer, we have had a lot of talks on preterm and then their survivals and their strategies, and this is the result that we are showing. And I think the result should speak for itself. Look at the PICU figure, over 5,500, nearly 5,500 patients with an 89% survival rate. And this is only a 1.5 years that we have been working. So if you look at the financial burden, आप सब जानते हैं प्राइवेट अस्पतालों में काम करते हैं कि आईसीयू की कॉस्ट एक पेशेंट की आजकल 70,000 to 100,000 per day आती है. Of course, we do not charge a penny from our patients. So everything that we do is free of cost with the support of Sindh government. And we say it everywhere कि जी लोग पूछते हैं आपके पैसे कहाँ से आते हैं, हम सीना ठोक के कहते हैं जी सिंध गवर्नमेंट देती है हमें. Thank you very much for that. Human resources are another area that we are concentrating. So one, we are concentrating on patient delivery. The other, we are concentrating on development of human resource, because it's not just a problem in Pakistan, it's a global problem. So हमें ज़्यादा से ज़्यादा लोग train करने हैं, develop करने हैं. सिर्फ equipment से काम नहीं चलेगा. We need the man behind the gun to be trained, properly trained, and then available for. So we are dealing with pediatric residency, critical care fellowship हमने शुरू कर दी है, neonatal fellowship शुरू कर दी है, and we are very soon starting the pediatric neurology fellowship. Dr. Farida is here. I'm sure she will be taking her fellows in the coming month or so. इसके अलावा we are training our technicians, which I think the most important work field, क्योंकि सबसे ज़्यादा problem doctor से भी ज़्यादा आता है कि trained technicians नहीं है. So we have started formal training courses. अभी सिर्फ 15 है पहले बैच में, but we are trying to increase this, and this will be available not just for our hospital but the entire province, because they can be trained from anywhere. We are providing full free training facility, बल्कि we are giving them money also incentive to be trained, and then hopefully we will be transferring them everywhere. उसके अलावा we have trained other people from DHO, Korangi, even private sector, so anybody we are trained. And this is also something which is very different that we have done at the public sector hospital. Dr. Saad was talking informally about the automation, and sir, this is the automation that we have done. We have a complete in-house automated data managing services जो customize हैं हमारे अपने हिसाब से, and everything that we do in our hospital is on the database. From the admission of the patient to the medicine to everything, उसकी हर चीज़ जो है वो automated है. So whatever figures we have, we can get an immediate figures. जो बात हो रही थी कि जी numbers पता ही नहीं चलते हैं. So we have the numbers, and we have shown this. It is doable, cost us nothing. मैडम सिविल का हमने वो सॉफ्टवेयर लिया है और उसको 2 लोगों को हायर करके हमने सारा काम किया हुआ है. Pharmacy, again, one of the different things that we have done, we have made the unit dose dispensing pharmacy by qualified pharmacists. So every medicine is prepared in our pharmacy, and then we get the orders through the computer and they are given the medicine. We've started this at NICH, but it was slightly on a smaller scale now. All the hospitals that the pharmacy medicine are dose dispensed, which is again a unique thing. एक और बड़ा इल्ज़ाम आता था जनरल पब्लिक का कि जी सरकार तो कुछ नहीं करती, हमारे लिए तो एक पैसा खर्च नहीं करती. So we have tried to negate that with the permission of the minister at that time, Dr. Azra. We have now created a bill for the patient, और बिल्कुल प्राइवेट अस्पताल की तरह उसका बिल आता है. So everything is accounted for, उसके drugs, उसके visits, और ये actual bill है, ये कोई fabricated नहीं है. This is an actual bill that we create. So he get the bill at the end, and it is written that this is paid by the government of Sindh. ताकि मरीज को ये पता चले कि सरकार उसके ऊपर कुछ ना कुछ कर रही है. And madam, this is the most important slide that I want you to take you with you. Reduction of neonatal mortality. We have been talking about a lot this since morning, and we have Samia has pointed this out. KG reduction, neonatal mortality, most scariest place to be born in the continent. We have colluded with JPMC and we have signed an MOU with them. Dr. Halima, I think, is here. Thank you very much, Dr. Halima, and everybody too, giving us this opportunity. हमने फरवरी में इनके साथ MOU साइन किया था और सर्विसेज शुरू की थी. So it's only about a year. लेकिन then we have developed a small in-house nursery at JPMC with the help of PAF ने हमें support किया इसके अंदर. तो एक हमने छोटी नर्सरी 8-10 बेड की वहाँ बना दी. सितंबर से ये डेटा हमने कलेक्ट किया है फरवरी 2024 तक. So only 6 months, over 10,000 deliveries have been done at JPMC, and these are the numbers. So there were 9,000 discharged home, some retained at JPMC. जो ज़्यादा ये हमने JPMC में retain किए, जो ज़्यादा sick थे उनको SICH transfer कर दिया, कुछ उसमें NICH भी चले गए, so on and so forth. Look at these numbers. Out of 10,000 babies that were born, there were only 10 deaths at JPMC. There were 33 that expired at SICHN when were transferred, so total of 43 deaths in 10,000 babies. The neonatal mortality has come down to 4.2 per 1,000 live birth. This is as good as anywhere in the developing world. Of course, थोड़ा बहुत ऊपर नीचे कुछ NICH भी transfer हुए, कुछ deaths वहाँ भी हुई होंगी, लेकिन it's about 4.2 to 4.8. So this is doable, and this is what we want you to take home with you. कि what we have done is कि maternal जहाँ deliveries हो रही हैं, वहाँ पे अगर हम newborn care को थोड़ा सा बेहतर कर दें, तो we can save a large number of babies, and there is no rocket science involved in this. As mentioned earlier in your slides, it's only a matter of doing the right thing at the right place at the right time. So thank you very much for that, and we are really proud, Dr. Halima. You know, they will, I don't want to say this, but a large number, okay, let's not go to the numbers, but there were a large number of babies dying every day, and this is what has happened with the support of everybody at JPMC. Madam, again, your attention. This is first time in Pakistan. We have not formally started this, but as per the discussion in our early board meetings, this is what we are doing. We have established the first human milk bank in Pakistan, and this is with the support of UNICEF. So very thankful to UNICEF here, who has provided us with all this equipment. We have not formally inaugurated it. We would request you to inaugurate this. हमारे पास सामान आ गया है, but we need to train our people and make sure. We have also got the fatwa for this, so it's a Sharia compliance, so that we don't run into any problems as far as the Sharia things is concerned. So we have got the Sharia fatwa, we have got the equipments, and now this will be very soon. We'll be starting the first human milk bank in Pakistan, and I'm sure this is not going to be the last. There'll be many more once we have established, and once we see the fruits of giving the breast milk to even the smallest of babies. So thank you very much. The research, a lot of institutes have been carrying out research, and public sector has always been blamed कि public sector में research नहीं होती. So we are very focused on that. Of course, हमारा time अभी बहुत थोड़ा हुआ है, but we have established the institutional review board. We have got a few publications, but most importantly, right from the start, what we are looking at, we are not just looking at doing research for the sake of publication. We are looking at the research which is patient-centered. So anything in our own backyard, in our own environment, we need to carry out research which will create the difference in the life of the children that we are serving. So not for the sake of publication or getting grants, which should be something that should be focused on the ground reality. The next impact is, Alhamdulillah, a very huge hospital in Sukkur, excellent state-of-art facility, truly state-of-art facility, given to us, to the Sindh government by the Korean government, and we have been very kind, madam, that you have given it to SICH for operational purposes. So this is, unfortunately, we ran into a little bit of trouble starting this because the court has, were not allowing us to do the hiring. But we have started the outpatient and already served about 40,000 children over there. And only from last week, We were able to start off the inpatient services, so we started, and these are the real pictures. So we have started ventilating babies and the older patients. So only in about a week's time, we have already catered for 200 children. That's a very good hospital and a real needed in that upper part of the Sindh, because there's a huge catchment area of Sukkur, which catches the Gotki, Shikarpur, Khairpur, and even Larkana for that matter, but we are hoping that we will go further up. So this is where we are right now. We have got few existing projects, Korangi, Sukkur, and we are almost starting the intensive care in Shahid Benazirabad. So this has been already given to us. In the immediate expansion, we are planning on the Mother and Child Health Center, which is the first under SICHN we are hoping to develop. We have run into a little bit of snag at the moment, but these two projects have already been approved by the cabinet. And then we are also trying to help out people at the Civil Hospital Karachi by developing our specialized services of PICU and NICU. And then in future, of course, we are hoping to go into Larkana, Mirpur, Khas, Kamba, Shahdadkot, and not Shikarpur, because Dr. Zeenat is sitting here, so she will not allow us to go to Shikarpur. Okay, thank you. So I think this is the vision for SICHN. So, you know, hospitals all around, maybe pediatric units, and of course they have to be connected. So good transport system that can transfer patient from one place to another. And I would love this share of Ghalib ke hai kahan tamanna ka dusra qadam ya Rab. मैंने अंग्रेजी भी लिख दी जिन लोगों को उर्दू मुश्किल लगे कि है कहाँ तमन्ना का दूसरा कदम या रब, हमने दश्ते इम्कां को एक नक्शे पा पाया. So thank you very much.